Capitol Hill focusing on the coronavirus today. A House committee grilled Dr. Anthony Fauci and top health experts on the administration's response, while lawmakers are still battling it out over a relief package. NBC News national political reporter Sahil Kapur joins me now. Sahil, let's start with that hearing. Hit us with the highlights here.
I am appealing to all Americans to be part of the public health solution. Wearing a simple mask properly, it's critical to limiting the transmission.
There's never a guarantee that you're going to get a safe and effective vaccine. But from everything we've seen now in the animal data as well as the early human data, we feel cautiously optimistic that we will have a vaccine by the end of this year and as we go into 2021. So I don't think it's dreaming, Congresswoman. I believe it's a reality.
All right, so we played some of the better moments. Sahil, walk us through what it was like today. Give us a sense of how the hearing went.
An important hearing on Capitol Hill, Allison, by the special House committee that was set up to deal with the coronavirus. We saw a number of important things here. We saw Mr. Redfield, the CDC director, talk about how he is imploring Americans to try to be part of the solution, to wear a mask, to do basic things. You heard Democrats grilling Anthony Fauci about some of the statements that President Trump has said, such as that the virus will disappear. Fauci has made very clear that that's not going to happen. We also had an important moment where Mr. Clyburn, who is the Democratic leader on this committee, showed a chart of U.S. coronavirus cases skyrocketing while European cases fell. And he asked Anthony Fauci about this, and he said one of the reasons for this is that those European countries had aggressive centralized lockdowns early, whereas the U.S. system was kind of a patchwork, decentralized sort of thing. And Fauci suggested that some states might have locked down too late and or opened up a little too soon.
Sahil, let's talk to you about the stimulus negotiations. Another big thing happening on Capitol Hill. We've been saying it throughout the day, but millions of Americans lose that weekly $600 unemployment bonus today. Is there any progress coming out of those talks?
None that we are aware of. There has been no progress on Capitol Hill after a chaotic and frenzied week. And those $600 in weekly unemployment benefits expired today. That's about 20 million Americans who are relying on that money to pay rent, to get groceries, to stay in their homes, are no longer going to have access to it. And we're left in a situation where Democrats are demanding that that $600 be extended. They passed a bill through the House to do just that. Republicans have become convinced that that $600 a week is a disincentive for Americans to go back to work. They oppose extending it at that level. They support, some of them at least, arguably most of them support extending it at a much lower level, reducing it to $200 and maybe allowing states to cap it at two-thirds of a person's prior wages. So we're seeing a partisan stalemate around this issue of how broad-based should those benefits be. And meanwhile, a lot of ordinary people who are out of work as a result of the pandemic are about to suffer for it.
Sahil, I know the Republicans and the Democrats aren't seeing eye to eye, but earlier this week, the Republicans weren't even seeing eye to eye within their own party. Are they still at odds over their own proposal?
They are still at odds over their own proposal. We've seen a variety of different proposals from Republicans. To start with, some of them don't want to continue any federal unemployment benefits at all. Some of them believe it should just expire entirely and that the states should run unemployment benefits as they see fit. Just yesterday, we saw multiple different proposals coming from Republicans, including one from Mitt Romney and Susan Collins, two senators, to start by reducing the payment to $500 a week from $600 and then gradually reduce it beyond that. That did not have the support of very many Republicans. There was another plan, as I mentioned, offered by Ron Johnson, the senator from Wisconsin, on the floor to reduce it to $200 or two-thirds of a person's wages. That did not go anywhere. And then what the last-ditch effort was, Martha McSally, an Arizona Republican who's facing a very difficult re-election battle this fall, called for a one-week extension of the $600. This was blocked by Chuck Schumer, the Democratic leader, who said it's not administratively possible to do this for 1 week. States need some lag time to sort this out, to get their systems up and running. And the benefits really ran dry last week. So it's not clear what 1 week would do.
Yeah. A lot of tough negotiating on Capitol Hill, and I know a lot of Americans are concerned and hurting right now, hoping for some relief. Sahil Kapur, thank you so much.
Thank you.
Congressman Jim Jordan grilling Dr. Fauci today about the role the protests have played in spreading COVID-19.
Dr. Fauci, do protests increase the spread of the virus?
Do protests increase the spread of the virus? I think I can make a general statement.
Well, 500,000 protesters on June 6th alone.
Yeah.
I'm just asking that number of people, does it increase the spread of the virus?
Crowding together, particularly when you're not wearing a mask, contributes to the spread of the virus.
NBC News medical contributor Dr. Kavita Patel joins me now. Dr. Patel, great to see you. I think a big question people have, can you still gather safely in groups if everyone is wearing masks, or is gathering in groups just a bad idea altogether?
Yeah, hi, great to see you, Allison. Happy Friday. Not generally speaking, if you're above the size of 10 people, it's not a great idea. If you are going to gather in a group for whatever reason, it's an absolute must to have a couple of conditions: masks, distancing, hand hygiene, and preferably outdoors, because we do know that being outdoors can make a difference in terms of circulation.
Could you talk to us a little bit more about that? Can you explain how a virus might spread in a crowd inside versus a crowd outside?
Yeah, it's really interesting, Allison. We now have some very clear studies all around the world, including the United States, about indoor circulation and everything from doctors' offices, by the way, which have pretty bad circulation, and restaurants that have old systems and that the air is not moving or might have bad filtration. And it's really even the simple act of talking, eating, or heaven forbid, coughing, and those airborne particles can linger, in the air from minutes, and then in some studies as long as hours. So outdoor circulation, we believe that when you cough or speak, the particles really just drop or are not recirculated. But indoors, it can be a problem, and it has been shown to be a source of infection and how we call these super spreader events.
Dr. Patel, Florida really having a rough go of it. Now Hurricane Isaias is approaching the state. All state-run testing sites are closing this weekend. What are your concerns as we deal with one of the first major storms this hurricane season during a pandemic?
Yeah, Allison, my heart goes out to everyone that's been affected by this, including the healthcare personnel who they're still dealing with double-digit positivity rates, which means this virus is still on fire in that state and not under control. And so not having those testing sites, Allison, means that we're not catching some of these important cases, and people who don't even realize it could be spreading it to other people unintentionally. And that can create, unfortunately, a reversal of any progress that they made. And that's another reason that we just have to do things kind of nationwide and not in a piecemeal fashion.
Dr. Patel, I want to ask you a question about a tweet that just came out. It's from Rep. Gomert, who we know has tested positive for the coronavirus. He is tweeting, "I am taking hydroxychloroquine to treat my coronavirus diagnosis. It was what was decided as the best course of action between my doctor and me, not by government bureaucrats. How long until the tech tyrants censor this tweet?" Now, I don't want to ask you about necessarily the politics here. I do want to ask you about the medical data here. What do we know about hydroxychloroquine and its effectiveness in treating the coronavirus?
Yeah, it's a great question. And I practice in a primary care setting. So trust me, I'm looking for bright spots that I can offer to patients with coronavirus who are not in the hospital. And here's the data. We know that it is not effective in the hospital. And we also know from studies of patients who took it who were not hospitalized that it can be shown to be harmful. So it did not change outcomes for people in both the hospital setting as well as the outpatient setting or outside of a hospital. So this is something that, Allison, I've been asking other practicing physicians around the country. There is really enough evidence to safely say that this drug can do more harm than it can benefit and should not be prescribed for the coronavirus, particularly if you're not in the hospital.
Dr. Patel, thank you so much for your medical expertise there, because I think people we've been saying this all along, but getting some mixed messaging, confused about what's smart to do and what's safe to do. I'd like to ask you a question about the flu. Some new data from China, Canada, even South Korea showing that social distancing measures are slowing the spread of diseases like measles, mumps, the regular flu. What does this tell us about the effectiveness of social distancing, and what should we be preparing for? What should we be expecting here in the U.S. this flu season?
Yeah, in the United States, especially during a bad flu season, Allison, we can see tens of thousands, as high as 60,000 deaths, with millions more just affected by being sick. And we are now seeing in the Southern Hemisphere, where it is their flu season, that the flu rates are really just amazingly low. So what that tells us is that the masks and the distancing and all the hand washing that you and I are probably getting tired of, it actually is working not just for the coronavirus, but for anything. And I even think we'll, Allison, see some differences with the common cold, because it's not just the flu season, it's measles, it's mumps, and all these other things. So I really hope that we can actually decrease cases of just the common cold, because we're all trying to do more than we were before. And I actually think, Allison, candidly, some parts of what we're doing and learning, I think it'll stick with us well beyond the coronavirus, because we're learning enough about how to protect ourselves, and that'll serve us well going into the future.
Dr. Patel, I'm no medical expert, but I think you're right. I mean, even just simple things that we're doing more of, washing our hands, being mindful of cleanliness, hygiene, surfaces, things we weren't doing before that could probably go a long way to fight a whole lot of other illnesses.
Yep, that's right.
Thank you so much for being with us. I hope you have a great, safe, and healthy weekend.
You too.
Hey, NBC News fans, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here, and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.